These are young broiler chickens, 13 days old. These chickens are suffering from a very deadly disease, velogenic Newcastle disease or VVND. Chickens have tremor, severe depression and death in a relatively short time. Some chickens add a fluid or exudate from the mouth. This will cause the litter particles to stick around the mouth or beak. In the case of avian influenza, it is common, but not common in Newcastle disease. Nervous symptoms are an important symptom of Newcastle disease. Some models of neurological symptoms can be found in Newcastle disease. Tremor, twisted necks, circling, torticolism, clonic spasms, and complete paralysis. But not all neurological symptoms can be observed at the same time. In acute conditions, paracute, tremor and paralysis are more common or in chickens without immunity at all. However, if the chicken can pass through an acute infection, then a few days later the symptoms of torticolism, twisted necks, circling, are common. This is the most common symptom encountered in acute cases. Chickens pack its beak into litter. This is very common. And this is a reflexive head movement that is often observed in the case of severe Newcastle disease. And another most important symptom of Newcastle disease is respiratory symptoms. Gasping, coughing, sneezing, and rales. Many diseases in chickens cause the same respiratory symptoms. The presence of death nervous symptoms followed by respiratory symptoms is as differentiating with other diseases. This is a packet of symptoms from severe Newcastle disease. But in the case of Newcastle disease in vaccinated chickens or with moderate immunity, the symptoms found are not complete as mentioned. This case occurs in commercial broiler chickens, closed house, double-deck, or 2 floors. And each floor contains 7,500 chickens. And the chicken has been vaccinated with live ND vaccine, with the spray method on day 1. On the 6th of April 2017, exactly, the chicken was 8 days old. Observed mild respiratory symptoms in some chicks on pen 1, floor 1. The wind flows and moves toward the pen 5 because the fan is at the end of the pen 5. On April 9, 2017, 3 days later, the chicken was 11 days old. Respiratory symptoms begin to occur in 80% of chickens on the first floor. In chickens in pen 1, respiratory symptoms look more severe, and there is death. On April 11, 2017, the chicken was 13 days old. Mortality rate began to increase in pen 1 to pen 4. From the date of the 6th of April, the number of dead chickens reached 950 chickens from 7,500 chickens located on the first floor. The sick chicken is seen reaching thousands. And clinical symptoms, or respiratory symptoms, begin to appear on chickens located on the second floor, in pen 3. Until this video is made, the death of chickens occurs very significantly on the first floor. 4,000 chickens have died. All chicken houses in this farm have been revaccinated against ND on the 15th of April 2017. See what happens next week on this farm. Follow us and subscribe our video to see what's happening in this case later. Why this case can happen? Newcastle disease in youth. Did not we know that young chickens have maternal-derived antibodies from the mother or high levels of antibodies from the mother? And these chickens have also been vaccinated on the first day. Is there a vaccination error? This is under investigation. This is a picture of a lesion in the kidney. This is similar to Gumboro symptoms or infectious bronchitis. If we connect with respiratory symptoms, we will be confused with IB. But if you associate with lesions in bursa of Fabricius, we would think this is a Gumboro. Come on, look at the image of bursa of Fabricius below. Newcastle disease virus is also capable of making severe lesions on the bursa of Fabricius. However, symptoms that distinguish it from Gumboro are respiratory symptoms, nerve symptoms and no lesions in the muscles. Here are the typical pathological symptoms of Newcastle disease. Hemorrhages of the proventricular mucosa and intestinal serosa are accompanied by multifocal, necrotic hemorrhagic areas on the mucosal surface of the intestine, especially at lymphoid foci such as cecal tonsils. Splenic necrosis and hemorrhage and edema around the thymus may also be seen. This is an interesting case to learn. This case is in progress until the video is created. What happens at the farm until next week? Follow us, subscribe our video. For a while this case is diagnosed as a case of Newcastle disease. We will also do a laboratory test to confirm the diagnosis. Did not rule out this is a case of a different disease, who knows? Like avian influenza, new virus. Maybe it could happen. Okay, do not forget to click the subscribe button. Thanks.